I'm Carol Dorsey, and I retired as lab manager of the Alabama Department of Public Health, Bureau of Clinical Laboratories, Mobile Regional Lab. The Mobile Lab analyzes specimens for disease-causing pathogens and environmental samples for compliance with public health standards for drinking water and shellfish. Daddy said, you better be able to get a job when you get out of college. So I had interest in nutrition, in horticulture, in life sciences, but I chose microbiology because I was interested in the subspecialties of bacteriology, virology, immunology, and microscopy. But from a laboratory perspective, all the protocols that we use have been rigorously vetted for specificity, sensitivity, reproducibility, and robustness before being employed for general use. Then laboratories and the analysts are evaluated by outside agencies such as FDA to make sure that we're handling specimens and samples properly. Our analysis is sound, that people know how to run the tests. All the quality control points that support these results and the reporting manner in itself is all part of quality assurance plans in place in these laboratories to make sure that the results that are reported are valid. So I enjoyed learning new procedures and protocols and the new platforms and the collaborations, partnerships that developed to address emerging disease concerns and environmental situations that called for new actions, and these public health niches like swimming water surveillance for the coastal areas. What comes to mind is when the bacteria that causes cholera, gastrointestinal illness that's transmitted fecal-oral route and through contaminated water was found in Mobile Bay. So it created a need for massive surveillance. How far has this extended? And so the partnership between federal agencies, state agencies, and us began sampling estuarine surface waters and wastewater effluents for Vibrio cholerae. We reported these results, which were used to determine presence and range of the organism in our waters. Fortunately, it only stayed for a few months, was detectable for a few months, and there were no reported illnesses. Cholera is life-threatening, so that's why it was a bit of a crisis. BP oil spill had a tremendous effect on the Gulf Coast and Alabama coastlines. The public health concern outside of respiratory and problems with those aromatics is the oil or the dispersant getting into the fisheries. So we collaborated with Conservation and Natural Resources in their Marine Resources Division to analyze fish tissues, and these are fishes that are found at various levels in the water column, what they eat, and would there be a cumulative effect, and we tested oysters that are sessile and stay in the same place, and crabs who move around. And over 3 years and thousands of samples, we didn't find the levels of oil products that would be considered deleterious. Surveillance for health standard compliance and for known disease-causing pathogens as well as emerging disease pathogens is critical to the health and the safety of our society.